Well, hospital admissions are rising rapidly. More than two-thirds of them yesterday were in the north of England, where infection rates are much higher than the rest of the UK. Health leaders have warned that the numbers going into hospital in some places there are at similar levels to the peak, and they've expressed alarm at the trend. And the infection rate is rising. On average across England, there are now 55 cases per 100,000 people. But across northern England, the situation is much worse. Look at the figures. The Manchester area has recorded 561 cases per 100,000. In Liverpool, it's 516 per 100,000. And now there are signs of an increase further south in the Midlands and the East Midlands, with Nottingham at 440 cases per 100,000 people. Our correspondent Dan Johnson spent the day there.
In some of our biggest cities, there is fear.
It's terrifying because we don't know how long this is going to go on for.
I didn't really want to come here today because they'd gone up so much, but we risked it.
There are appeals for more action.
We have got to do something. I don't know whether we're going to go down, hopefully not a full lockdown again like we did last time, but who knows.
Just the restrictions, just to get it over with, reduce the spread for a while. I mean, it's not ideal, it's not great, it's not what I would like. And
calls for greater clarity.
I look at what the Scots are doing, and that seems to be clearer messaging from the Scottish government, but that's a different issue in itself. But clear messaging, it's the balance between public health and keeping the economy going.
How long is it going to go on for if people are not taking it seriously? That's what I'm worried about a lot.
Case numbers have surged here, pushing Nottingham to 5th highest in England.
This has been the quietest day since we opened in July.
And Sam is seeing the impact.
I think that is because of the rising cases. I'm sure that's people are just more cautious about coming into the city, spreading anything, catching anything.
But over the last few days, they have increased exponentially.
So those in charge are asking for tighter rules.
Whatever restrictions come in, I would plead with the government to make them straightforward, to make them easy to understand. Some people a small number of people are ignoring the restrictions now, but others are confused. I've had many emails this morning already asking me what people should do.
In Leeds, extra measures are already in place, but cases have kept rising.
And we just hope it doesn't come back to a full lockdown again, where people can at least come and have some sort of socialising, some sort of eating out experience.
It's very sad because we are old and our lives are our children and grandchildren. We can't see them.
I don't see how they can restrict me even more. I don't mind if they close pubs altogether.
But back in the Midlands, there are voices urging a different approach.
All that you're doing is stopping business, stopping people enjoying themselves, and we've achieved nothing as far as I can see.
So what do you think should happen?
Let things go back to normal. Take all the restrictions away.
But further measures are coming as this city and others struggle to keep the virus under control. Dan Johnson, BBC News, Nottingham.
And as Dan hinted there, restrictions for parts of England are expected to be tightened next Monday, including the possibility of closing pubs and restaurants. The government is set to introduce a tiered approach in which different parts of England are placed in different categories. Labour has demanded to see the scientific evidence behind the 10 p.m. curfew rule, and it's accused the Prime Minister of lacking clarity in his handling of the pandemic. Our political editor, Laura Kuensberg, has this report.
Masks in the morning for the Commons Speaker and his entourage. A sign you can see that once more the pandemic is at the front of Parliament's mind.
Questions to the Prime Minister.
With doubts here over whether Minister's strategy is really working at all.
20 local areas in England have been under restrictions for 2 months. Prime Minister, in 19 of those 20 areas, the infection rates have gone up. Something's gone wrong here.
I wish I could pretend, Mr. Speaker, that everything was going to be rosy in the Midlands or indeed in London, Mr. Speaker, where, alas, we are also seeing infections rise. And that's why we need a concerted national effort.
Not enough for Labour.
So will he level with the people of Bury, Burnley and Bolton and tell them what does he actually think the problem is here.
What we are doing is a combination of national and local measures, which one week, Mr. Speaker, he comes to this House and supports, and the next week, mysteriously, he decides to whisk his support away.
Whether in Sunderland or Salford, more than 17 million people in the UK are living with extra limits already. Nearly 13 million in England. But as the disease still spreads, might there be more? Everyone round here is desperate to avoid another national lockdown. But with cases still rising, further clampdowns are likely to be on the way. The Treasury's nervous about extra rules choking off the economy, so is looking at extra support for pubs in the north of England and beyond if they had to close. For their part, the Department of Health is keen on a system of different tiers, where parts of the country would be put into different clear categories. But the opposition and Tory MPs are getting more and more sceptical as each day goes by of whatever the government's proposing. There are a lot of complicated factors here, and Number 10 is yet to decide. And as the need to act further seems to become more urgent in Westminster, tensions are rising among the politicians who'll have to deal with restrictions on the ground.
Too much is being decided behind closed doors, without the detail being provided to council leaders and mayors, and that is not acceptable given the seriousness of the situation.
The government's clearly moving to a different phase of coping with COVID, but with no announcements perhaps until Monday. For the detail, you'll have to wait. Laura Kunsberg, BBC News, Westminster.
Let's have a look at the latest official coronavirus data from the government. It shows there were 14,162 new coronavirus infections recorded in the latest 24-hour period, a similar number to yesterday. It means the average number of new cases reported per day in the past week is 13,002. Hospital admissions jumped significantly on Sunday. Now on average 496 people are being admitted every day over the past week. And this number does not include Scotland. 70 deaths have been reported. That's people who died within 28 days of a positive COVID test. Again, a similar number to yesterday. It means on average in the past week, 53 deaths were announced every day, which takes the total number of deaths so far across the UK to 42,515. So with those official statistics in front of us, Hugh Pim is back with me, our health editor. We're talking about rising numbers of cases, rising numbers of hospital admissions, and alarm is being expressed at senior levels.
That's right, Hugh. Tonight, the Academy of Medical Royal Colleges, representing medical profession leaders, has come out and said that unless people follow very carefully the lockdown rules in their area and social distancing guidelines, then, quotes, there's a real danger of the NHS being unable to cope and possibly, if admission numbers carry on going up, being overwhelmed. Quotes, we could soon be back where we were in April. Now, earlier NHS providers representing trusts in England sounded a similar warning. Chris Hopson, the chief executive, said although admission numbers each day are well below what they were at the peak, that conceals regional variations, and that health leaders in the north of England were saying that admissions were rising so rapidly that they feared current restrictions weren't working and more was needed. Now, as we've been hearing, there's a big debate going on across government in England about precisely what restrictions might be introduced next week, the interests of the economy being considered to get the balance right there. But certainly Whitehall sources are indicating tonight that these warnings from the north of England about hospital numbers are a cause for concern.
Hugh, many thanks again. Hugh Pim, our health editor there.